Our next and last speaker is Dr. Suriana Sultana, Registrar, Department of Clinical Oncology, Delta Hospital Limited, who will talk about real-life retrospective single-arm study of postpartum breast cancer, epidemiological insights into uncommon and critical cases in Bangladesh. Dr. Suriana Sultana.
In the name of Allah, the most gracious, the most merciful, Honorable Chairperson, the panel of experts, and the learned audience. Assalamu alaikum. Thank you, Dr. Shamima Afroz, for kind introduction. As the youngest speaker of this session, I feel very much honored and privileged to stand this large platform and presenting my topic. My heartfelt gratitude to the organizer of the Bangladesh Breast Cancer Conference 2025 for selecting my abstract and giving me this rare opportunity. As you see the screen, my topic is a bit uncommon, that is postpartum breast cancer, insight to the uncommon and critical cases in Bangladesh. For every woman, pregnancy and postpartum period is very crucial, and the mother and the whole family are very concerned about the unborn or newborn child and neglecting the mother's own health. But in this happy period of time, some deadly disease like breast cancer can occur and make the whole family upset down. We are familiar and concerned about the breast cancer in special situation like pregnancy, as the management is different from the other subtype, but we did not pay much attention to the postpartum period as the management is same, but the prognosis is different. Previously, pregnancy-associated breast cancer was defined as the breast cancer occurred during pregnancy and first 1 year of the postpartum period, but the perspective has been changed. Several meta-analyses shows that the women who have diagnosed shortly after pregnancy has poorer survival and a higher mortality rate. So in 2021, the Lancet Oncology has published an article where the pregnancy-associated breast cancer is divided into separate two identities, that is breast cancer during pregnancy and postpartum breast cancer. As we know, the 35 to 55% of breast cancer patients are younger than 45 years, that is reproductive age. And the postpartum breast cancer occurs after the pregnancy, typically within a 5-year window. Some study shows about the 5 to 10 years of year group. It has increased risks of metastasis. The survival is odds 2 times higher than during the pregnancy and breast cancer diagnosed at the other time in a woman's life. Let's see why what's the outcome of clinical outcome of pregnancy-associated breast cancer. There is hypothesis about that. There is a hypothesis that during the pregnancy, the primary epithelium has some influence during the pregnancy, but after delivery, there is some involution to the pre-pregnant stage, which causes a wound healing-like reaction in the microenvironment and influx of some immunosuppressive cells, which causes the escape of tumor cells and causes the risk of metastasis. This alter immune infiltration and cytokine profile both are persistent several years after the delivery. There are some other causes due to poor prognosis due to the delayed disease presentation, as there are several differential diagnoses in this period. Most commonly are varicocele and breast abscess. The others are young age at presentation and adverse histology. Let's move on to our main topic of this session, what we have found in this study. In our oncology specialized hospital, under the single consultant, we have found 20 postpartum cases of breast cancer. And the result shows that the age group, most of the common age group is the 30 to 35 years, and the median age is 32. There are some young age also present with the postpartum breast cancer, but the significant point is a woman who are 35 to 40 years has advanced disease presentation and adverse histology. During the diagnosis, the age of the last child was less than 2 years in the most of the cases, and more than 2 years is 20% of the cases. In association with lactation, 75% of the women are diagnosed during lactation, and 15% of women are diagnosed after the cessation from lactation, and 10% of women have no history of lactation in this period. We have found a significant criteria that the most of the women diagnosed during the second pregnancy, after the second pregnancy, about 75%. The demographic profile shows that most of the patients, about the 90% are reside from the rural area, away from the capital, which significantly affect the early detection due to the logistic support of the nearby hospital. There are also some significant family history in 20% cases, and obesity also related to the 40% cases of the women, and a significant cause of oral contraceptive pill more than 5 years also found. So why there is late diagnosis? Due to most of the patients have no knowledge about this type of cancer, that is postpartum breast cancer, and they did not take the pain seriously. Due to the breast congestion, the main mild pain occur in this period, and they did not examine the breast periodically and did not take the breast lump seriously. The significant point is when the suspected patient attend to the nearby local hospital, the 70% cases misdiagnosed by FNAC, which lead to delayed diagnosis. The histology shows that all are the ductal cell carcinoma. The grade are almost 80% are poorly differentiated, that is high grade. And the receptor status shows that the 50% of the patient are TNBC, 30% are patients who are hormone positive, HER2 negative, 15% of the patients are hormone negative, HER2 positive, and 5% are triple positive breast cancer. We note that the patients who are hormone positive has the advanced disease or metastatic in presentation. In the presenting stage, we found that 50% were locally advanced stage, that is node positive breast cancer. In this 50% patient, 10% patient have disease progression during the treatment, and 10% had recurred shortly after the treatment. We also found the early stage of breast cancer in this period, that is 30%, and 20% of the people present as a metastatic disease. The most metastases are the bone and the liver. So in conclusion, this small study indicates that the postpartum breast cancer is a matter of concern recently. The diagnosis is a link to the poorer outcome, particularly in estrogen positive through the majority of the patients were TNBC. The aggressiveness of postpartum breast cancer associated with the initial misdiagnosed and delayed presentation. So we emphasize the importance of early detection through the periodical screening by self-based exam during this period, and any suspected lump in the postpartum period should be evaluated by core biopsy. This study also suggests that the creating awareness among the postpartum women, particularly lactating mother, which is crucial for early detections. Further studies are needed for longer follow-up and the larger size. Before I end, I need to share the inspiration behind the study. During my last year of fellowship training at NICRH, I have a bed patient called Helena, who was 34 years old and diagnosed of postpartum breast cancer after the 8 months of her second delivery. And she was treated, but the aggressiveness disease was so aggressive that the metastasis, she developed multiple site metastasis within a short period of time. When I asked why she did not attend to doctor clearly, she told that she attended doctor very early, but she was misdiagnosed by FNAC and treated conservatively for breast abscess several times until the disease got into T4 stage. So I again emphasize to create awareness of the postpartum breast cancer among the all period in the reproductive age. Thank you for patience hearing.